Welcome to 41 Today Lifestyle, everyone. Joining me in the studio today is Dr. Stevenson and Lauren from Optim Neurosurgery. Welcome back to the show, my friends.
Thank you.
Always good to see you. Now, one of the conversations that I wanted to bring up, because this does get thrown around a lot, MIS, minimally invasive surgery. Why does it get thrown around a lot, and why do we not understand what it actually stands for?
It gets thrown around a lot because it's a buzzword.
Okay.
And a lot of people will use it as a marketing tool, but really it's a philosophy of treating the patient both surgically and non-surgically. So it's a whole lot more than, say, one surgeon making a 5-inch incision as opposed to a 6-inch incision. It's an overall treatment philosophy.
Well, why is it so important in your practice to be performing this type of surgery?
The main reason is the benefits to the patient.
Right.
Patients just plain do better. A lot of our surgery is not life or death, it's lifestyle. And
Yeah.
people want to get back to their lifestyle more quickly, and a minimally invasive approach absolutely allows that to happen.
So when you say MIS, are you talking robotic surgery or are you still talking manual surgery?
It is a marriage of both, really. So true MIS surgery, there's specialized equipment that includes robots, that includes different navigation devices, kind of like GPS for the spine, specialized instruments, specialized endoscopes, just basically doing the surgery through 1-inch incisions or less with minimal disruption to the normal anatomy of the human being.
When people are having, Lauren, MIS for their surgery, what are you saying to them for aftercare when they're going home?
So they still, obviously, minimally invasive surgery is still surgery. We're doing the same job that we would do if we were doing traditional spine surgery. So there still are restrictions, but we typically have to tell the patient to slow down a little bit because they feel so much better after surgery. They want to move more quickly. So we're usually telling them, let's remember, minimally invasive surgery is surgery. We still need to take it easy for a couple of weeks, depending on what type of surgery they're having done.
Well, especially because I was about to say to you, as you were saying that, because people feel when that buzzword is thrown around, it is still the same operation. It's just getting you back on your feet faster.
Yes.
It is, and the key thing that the Society for Minimally Invasive Spine Surgery says is minimally invasive surgery cannot be minimally effective. So it is still accomplishing the same goals, just doing it in what we think is a much better way.
How do you both determine who is the right candidate for MIS?
I would say the first thing we do is get an MRI. Obviously, the last thing we want to do to a patient is do a surgery that doesn't effectively treat them.
Right.
So we get an MRI, we look through that pretty thoroughly, and then we can talk to the patient, based on their symptoms too, because we don't treat MRIs, we treat patients. So we talk to them about their symptoms and determine, can we do what we need to do effectively with MIS surgery?
Mm-hmm. And we start, every patient, we assume we're going to start thinking MIS. Now, if there's something along the way that says, boy, that's not the best option in this patient, we'll talk about doing something maybe more traditionally, because not every patient is ideally suited for it. But in our practice, that's where we start and we go from there.
All right, let's very quickly talk about the benefits of MIS.
Yeah, so obviously the patient gets moving quicker, there's less infection risk, we're disrupting less of normal anatomy than you would be if you were to do traditional surgery.
Less blood loss.
Yes.
Really?
Less postoperative pain.
Yes.
Less bruising.
All that.
Less pain.
Less everything.
I do want to ask you, because when you do those robotic surgeries,
right,
and more and more people are getting into that now as well, but there is extra training. Is that part of your insurance? Do patients ask you that?
I don't know that a patient has ever asked us that before. They're just excited to be a candidate for it, and I don't know that we've really ever had an insurance say,
Right, and really any more...
Because people get nervous about that.
Sure, and really currently, and I'm no insurance expert, but insurance does not pay a premium or anything for this technology. So there's no additional cost for this either to the patient or to the insurance company.
But we want everyone to know at home, it is always best to ask if need be, if you have concerns about it.
Absolutely.
No upfront. We appreciate you two give us great information. I know our audience appreciate it. Thank you so much. We really appreciate it.
Thank you.
If you want to find out more about Optim Neurosurgery and Dr. Stevenson and of course Lauren, they're amazing. All the information's up on the screen. Back after this short break.